not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning. We are very happy to now we went from financial planning, Social Security, which is very, very important because
To plantar fasciitis.
right, but most of your patients are Social Security recipients.
Right.
You know,
Yes,
and that's,
yes.
let me just put this up here. Okay. So that's really important, but you always bring in subjects when you come are hard to pronounce. Why did the medical world do that?
Well,
to keep us all off guard.
Well, many years back, just like English is the language of international communication today, Latin was the language of science. So a lot of things, in order for country to communicate with other country, you have to learn some Latin. So in today's age, when you go to medical school, one of the first things you learn in medical school, and as well as nursing, in healthcare in general, they all teach you some Greek roots and some Latin roots because they basically compose the majority of terminologies that are used.
I see. Thank you for that explanation. So when you come up with these strange names, it's not something you invented.
No,
it's
sometimes I think about creating my own name. But
right,
no.
probably. Recently we did...
Put some Hawaiian words in there.
Yeah, Hawaiian words. In your article for this month that we just did in August, it was called Happy Feet, and we really talked a lot about it because I personally have never had a problem with my feet, but I have to tell you, I guess as I've aged, the bottom of my feet must have lost some padding.
The padding. Yeah.
And I can't wear the high heels I used to. In fact, I've tried, but I always wind up with really sore feet. What am I going to do? I can't. Where am I going to get new padding from?
Exactly. Well, that's where nowadays what we are doing, well, there's two things. There are people out there that they think they're going to save some money, and they go to the pharmacy, and they buy inserts from the pharmacy. And they even try to tell you that they're going to give you a special number that is, your number. But if you look, they have like 6 choices or 8 choices. And when you go back in medicine and look at people's feet, the choices really don't fit the needs of the person. So to give you an example, you and I can have the same pressure point in our feet, but the arch could be higher on you than on me, even though we have the same pressure point. So those machines, when you step on those machines that they have in the pharmacy, and you put your feet there to get a insert, they are not right custom made. You have to measure what we call the heel and the valleys to determine that you are putting the right insert for your feet. So when a person comes to a doctor's office, like when you come to my office, what we do, we put you in a mold, and we do a mold of your feet, so we can see the arch, and we can see those valleys and heels. So we want to see how high is your arch and where you have your pressure point. So we take each of your foot and we press it down and make a mold out of that foot. And the way we try to explain it to people is like having glasses made for you. When you have glasses made for you by an optometrist or an ophthalmologist, your right eye and your left eye will have different measurement. And one of your eye have a tendency of looking in one direction versus the other. So the glasses had to fit your eyes. So even if we have the same measurement, you and I, with glasses, if my eye is a little bit deviated, my left eye, let's say, deviated out or inward, when I put on your glasses, I cannot see as well, even though we have the same number. So you wanted what we call custom-made, those eyeglasses. You want to custom-made your inserts so that they do what they are supposed to do, which, get rid of the discomfort when you're walking.
That was a fantastic explanation. So you're telling me you want me to come, and of course, I know you're a podiatrist, and you're saying that it is possible with measuring my feet, I will be able to wear shoes and not feel that pain?
Absolutely.
And that's from the way, the position of the arch.
Exactly. And the pressure.
Wow.
So we take into account the pressure point, because some people have a tendency of putting most of their weight toward the toes. Other people have most of their weight exactly in the center of the foot, right by the arch, and other people more toward the heel. And that's why you see some people have a tendency of falling backwards, some people have a tendency of falling forward, where most of us have a tendency of falling forward. But there is variation on where your weight distribution is. Also, as your spine change position, the change of the position of your spine change your weight distribution also. So you can have today your weight distribution could be perfectly toward the front, but if you start having a scoliosis or back pain or a sciatica, then you start changing position to avoid the pain, and that change in position change your weight distribution. So that's why sometimes I have patients come to me and I say, have you have a custom-made insert? And they say, oh, yes, I have one. I say, well, I think, it's time to do it again because it was 10 years ago. Oh, no, my insert was really good when they gave it to me. I think my problem is something else. And I will go back and say, no, your problem is your insert. They are too old. Just like glasses. You cannot make a pair of glasses and wear the same pair of glasses for 10 years. You have to, go along with your weight distribution. If you gain weight, you're going to change your weight distribution. If you lose weight, if your spine change, if you have a hip replacement, if you have a knee replacement, all of those things is going to affect how your weight distributes to your feet. So you have to try to change. And a lot of time we tell the patient, listen, if you don't want to get into the inserts, then buy new shoes.
No, but the new shoes, no, that's not right for me, at least, because I have very high arches, but I buy new shoes, and
it will never take care of your arches.
No, but no, it's not taking care. So I definitely have to come to you because I am having a problem with shoes because I want to have nicer shoes, and I'm not buying the right shoes apparently. So I'm going to come there. Thank you. That's Dr. Andy Mencia who is talking. He is our geriatric physician. He is also the founder of the Adult and Geriatric Medical Center. They have home visits. For homebound patients, they're open on Saturdays. Their phone number is 954-489-1345. I'm Anita Finley, and we are listening to The Star Show. All right, we're going to get back to
Ina
what
Leskowy, the star of...
yeah. Hi. Yes, right. Ina, that's right. We have her picture in the Boomer Times. So she comes to our show many times. We let her talk a little bit. And then but we definitely appreciate all the work. She is the administrative assistant there at the center, and a very kind and very smart young lady. So let's talk about what you brought in.
So, usually when you're having problems, some people they wake up in the morning and they say, when I'm in bed and I'm sleeping, I'm fine, I'm doing okay. But when I wake up and I take those first few steps, when I'm out of bed and I take those first few steps, I get a tremendous pain on the heels of my feet, on the bottom part of the feet toward the heel. And the most common cause of that heel pain is what we call plantar, and that's for the Pencil Talk radio listener, Plantar fasciitis. And plantar fasciitis comes from the plantar fascia, which is a ligament that goes from the heel toward the toes and compose the arch of your feet. And fasciitis, you spell it, if you're going to look it up in the internet, F as in Frank, A S as in Sam, C as in Charlie, I as in India, T as in Tango, I S. Plantar fasciitis. And so plantar fasciitis is the most common cause of heel pain. And so this ligament goes from all the way, the plantar fascia is a ligament that goes all the way from the heel on the bottom of your feet toward your toes. And that's a whole big ligament. And if you strain the plantar fascia because you're walking on hard surface, it can get weak, it can get swollen, and it can get irritated or inflamed. And the inflammation is what produces the pain. That's why a lot of time we tell the patient to put the feet on ice to cool the system down. If you have an ice pad, just put the ice pad and put your feet on top of it.
So this isn't something that you've done, like had an accident or anything. It just happens?
It's a chronic accident. It's not an acute accident. So an acute accident is like when you have your Achilles tendon that tear or something like that. That's an acute problem. But it's a chronic accident. It's something, let's say a person that tend to, a soldier that is on their feet a lot. And they have to wear those hard shoes, those hard wear. And there's no support, there's no cushion. So it's very common to see it on soldiers, on ballerina, people that walk barefooted on the street, marathon runners that tend to run on hard surface. So there's a lot of people at risk. And as you mentioned at the opening of the show, that you're losing the padding on your feet. Once you're losing that padding, then the plantar fascia is exposed to the floor.
Oh, I see.
So as you start walking barefooted, then you are basically putting pressure on the plantar fascia.
It's interesting you should mention that, because a lot of times I have a computer that a desk that's a sit-stand desk, and I stand and I do that barefooted. But I notice after doing that for a while, my feet are tired. But if I put on slippers or sneakers, I don't have that problem. So you're telling me, in essence, I need that padding.
You need that padding. What kind of floor you have?
Tile.
Tile. So
that's what you're telling me,
right,
isn't it? I probably
right.
should, even for my computer, get a pad or something that I'm standing in. Okay, but let's just keep going with this. So you're saying that somebody has this pain, that does it go away, or that just stays after they get up?
Yeah, usually they will complain. That the chief complaint is that the person say, when I'm in bed, I'm okay, because your feet are up, and you are not putting any pressure on the plantar part, on the sole of your feet. And when you get up and take those first few steps, then you start feeling the pain. And as you continue to walk, it gets a little bit better. But when you go to work, or as you carry on through the day, then toward the afternoon, it gets worse again. So they know it's a problem that is not just there and disappear, it's there and it continue to wax and wane with the symptoms. And
Excuse me, is this common, Dr. Mencia?
Very common. Plantar fasciitis is very, very common. And you see it again in a lot of athletes coming with plantar fasciitis. If they want a quick fix, of course, then you inject steroid in there, into the fascia, which I don't recommend. I recommend go holistic first. Sometimes I get a anti-inflammatory patch, like a Flector patch, one of those anti-inflammatory, and put it at the bottom of the feet on the patient. And, find out if they're using the shoes for a long time. Sometimes you have a favorite shoe that you wear, and you keep using the same shoes. You have to alter, you have to change. And sometimes you want it for the lady, if you wear the high heel, you don't want to wear high heel all the time. You can, but if you have a 6-inch today, tomorrow you might want to do a 4, then you want to go with flat feet. So you want to alternate, because remember, the height of the heel is determining your weight distribution. So the 6 inches pushing the weight distribution all the way toward the front. And then the next time when you wear a 4, you're bringing it more toward the middle. And when you go flat, then you put in it your natural weight distribution. So you want to alter. You don't want to wear always the same height on your heels. And a lot of women, they make that mistake. When they buy shoes, they like, let's say, 3 inches height in the heel. And all their shoes are 3 inches high. And that's no good, because then you are always putting the weight distribution, that stress on the ligament, 7 days a week if you wear high heels 7 days a week.
I'm always amazed. I sit here listening to you and I'm saying, how does he know all this stuff? It's like amazing to me. And it's simple stuff, and you say it so easily.
It's the secret of combining holistic and traditional.
It is. You are an amazing person. I mean, we never, I know you're not a podiatrist, but you sure know what podiatrists know.
I have cut many nails in my life.
One thing I do want to say, though, for everybody who's listening, of course, you know that at the Adult and Geriatric Medical Center, they have, of course, a fantastic dental department. They have an ophthalmologist, neurologist, cardiologist. They have the weight loss programs. They have, of course, the geriatric medicine with Dr. Mencia, a podiatrist, a dermatologist, a nephrologist, psychologist,
aesthetics,
hormone replacement therapy, a dietitian, nutritionist, and they now have a pulmonologist.
Yes.
Which they have a big center next
Dr.
door
Robinson.
to them. Yes, he was there. He was wonderful.
Yeah, he was very
wonderful.
happy to come
well,
to
I
the
just
show.
wanted to say that. And of course, their number is 954-489-1345. And the Adult and Geriatric Medical Center does have home visits for homebound patients, and their center's open for Saturdays. Let's keep going with this. This is a fascinating subject.
It is, and who should be looking for this condition? Again, are those people that tend to roll their feet inward. Is what we call pronation of the feet. So when you take your feet and you roll inward toward where you step more in your
on the outside of your foot,
outside
right.
of your foot, and your toes tend to be lift up when you're walking. That's called pronation. And those people that tend to pronate their feet, they are more at risk because they are stressed. They are putting extra strain on that ligament, so they are at risk. If people that have a very high arch or a flat feet, they both are at risk. So some people say, "Oh no, I'm okay. My arch, look how big it is."
Yeah, but so you're saying that's not so good.
Because a high arch, that means that you have a very tight ligament. And a flat-footed person means that they have a very passive ligament. So they both are at the extreme. Okay, that's why I love my arches in the middle.
I love my arches. Okay.
If you walk or you stand for a long period of time, especially on hard surfaces, you are at high risk.
Oh,
and you
boy.
notice, people will notice in the afternoon when I'm slowing down with patient, I go up into my office, I take off my shoes and I put my feet up.
Do you really?
Every afternoon, right?
And that's
Yes, it is.
and that's not because he's lazy, but because you need to give your
right,
legs
it's my profession.
and your feet.
I'm on my feet all the time. I'm moving. I'm walking. So when I finish doing my work, I will do that. And I remember my father used to take ice and put his feet on water and ice for
Really?
about 3 minutes.
If I tell that to my staff, you come into my office, you're gonna see everybody with their feet up, right? With this is you do it too.
Yeah, in Japan, very interesting because they are very much into prevention. So in Japan, when people go to work, it's mandatory. It's part of their work to stop a certain period in the morning and then in the afternoon, and then they do some stretching exercise. You can take a towel and put your feet forward and stretch the Achilles tendons to prevent plantar fasciitis, and you will do breathing exercises, and you lubricate your joint by moving your shoulder, moving your elbow, moving your wrist. They become more productive as a society and less sick by doing a little prevention. So
well, this is great stuff, and so I guess with everybody's feet. So if you have a patient and they come in and they've come in for something else, there's nothing to do.
Can you imagine somebody come to my office and everybody's up with their feet? They're gonna say, "Oh, these lazy bumps."
Right. No, that's true. I can see this happening the same way. But so what you're doing though, when you then
Elizabeth with her feet up.
make sure everybody wears
Patricia.
the women they have to wear long pants, right? Otherwise we have another
for
problem.
sure.
But Dr. Mencia, you so when you have patients come in, do you automatically look at their feet to see, or you ask them those questions?
I ask them, yes, and a lot of time we tell them, to take off their shoes so we can take a look. Like all my diabetic patients, I tell them, all my diabetic patients, unless you have a podiatrist, I want you to see mine, and unless you have an ophthalmologist, I want you to see mine. And Then those of my patients that say that they have either a podiatrist or an ophthalmologist, I say, well, how often are you seeing your consultant? So, and if they're having a problem with the copay or what have you, we try to accommodate for them. So that is more important that you see your consultant, like your eye doctor and your podiatrist, your foot doctor, at least every 3 to 6 months. People should not wait a year. I don't care if you have type 1 or type 2 diabetes. If you develop it 5 years ago or 50 years ago, regardless, those are conditions that need to be attended to, because you can do a lot of prevention if we attend to conditions that can complicate, that come as a complication of diabetes. So, and talking about diabetes, the patient with diabetes can have what we call peripheral neuropathy, and that's not what we're talking about today. This is not peripheral neuropathy. This is a completely different subject. Plantar fasciitis and peripheral neuropathy are completely different.
But if someone doesn't know what they're doing, they could say that's what you're saying, right?
Right. So if you have diabetes and you have the pain when you get up and walk, that is not peripheral neuropathy. You need to see, either your doctor need to examine you properly or your podiatrist.
Well, Dr. Mencia, if you have the plantar fasciitis, how can you walk then, though? I mean, how you said it's only in the morning when you get up?
In the morning when you get up and take those first few steps, you feel it. And as you go on, you go to the bathroom, you do this, you start showering, what have you. You start feeling a little bit better, especially if you shower with cold water. The cold water is running through you. So you start feeling a little bit better. And then toward the afternoon, as the day go by, that you put in stress on the ligament, then you feel it again. So that's the classical part where, let's say, peripheral neuropathy or arthritis, you feel the pain even when you are in bed. Mm-hmm. When plantar fasciitis, when you are in bed, you are resting. That's one of the treatment. The treatment you want to rest your feet so that the inflammation goes down. People can take anti-inflammatory over the counter. If you want something holistic, you can take some turmeric with hot water or hot tea 2 or 3 times a day, and then decrease it as the pain goes away, because turmeric is an excellent anti-inflammatory. If you like over-the-counter anti-inflammatory, you can take ibuprofen, Aleve, or even aspirin. Anything that decreases inflammation will help you. And then the extreme, for those people that like the injection, then we can do a steroid shots. Now, when people go for a steroid shot, if I have to do a steroid shot, I have a technique that I use paper tape. So what I do, I inject the area where the patient is having pain, and I take about 3 or 6 inch long, depending how big is the foot that I'm treating or the feet. And I put a lot of pressure with the paper tape to sort of create a support on the area that is in pain. I'm trying to keep the medication there. Then I send the patient home, and I say, okay, put ice on this area. 10 minutes every hour, something to that range. And I can get the patient better in a day.
Wow. That's because, I can feel, it's funny. I've never had that problem, but I could feel the pain. And so that's good that you're able to do that. Is there anything else that, and you talked about ice. So if someone gets up and they're having pain, should they put ice on that foot?
If you're having pain, ice usually is the way to go at the beginning. You can put ice if you have a cold pad. You can also use that and just put your feet on there. And
what does it do? Why does the ice relieve that?
It just decreases the inflammation. It's the yin yang, right? Inflammation is fire.
I see.
So ice is the counterpart to fire. You just put the fire out.
Right. So you don't want a hot bath.
No, that would make it worse.
That's what I'm just thinking. A lot of times when people have pain, they go into a hot bathtub.
Right, no, that would make it definitely worse. No, because the thing, when people do things like that, if you think about it, it's like putting fire on fire. And the ligament can only take so much. So the ligament is already inflamed. So if you put heat on that inflammation, you can break the ligament. Now you have a different problem.
Oh, different
Now we're
problem.
talking about surgery.
Okay. No,
yeah,
not
so
doing
you
that.
need surgery to retie the ligament. And surgery, with all my due respect to all my colleagues in surgery is not what God made for you. It's always
Right.
a little bit different.
Something else. Okay, so we want to use ice, and we want to go to see Dr. Mencia. That's the thing we want to do to make sure that you can help them.
Absolutely.
Okay, and so now.
So to make the diagnosis, when
yes.
you go to the doctor, sometimes we do an X-ray, and the X-ray basically is looking to see if you have what we call a stress fracture. So it's not full-blown fracture, just a tiny fracture in one of your bones in the feet, or that foot that is being affected. And if there is a stress fracture, then the treatment will change. But the presentation is so classical for plantar fasciitis that a lot of times you don't even need the X-ray. All you need to, listen to the patient, give you the information, look at the feet. And when you look at the feet and you examine, one might be more painful than the other one, but both need to be treated. That's very important. So, and also if you cannot come to the doctor, it's a long weekend or something like that, the first thing you want to do, wear shoes with good cushion. Okay, so when you get up in the morning, don't wear those flat sandals, those tiny sandals.
Oh, boy.
That makes it worse because it's hard surface on hard surface. You need that cushion to rest your tendon. So the ideal treatment is basically rest your feet. You want to cut back on your activity. Avoid walking or running on hard surfaces. Sometimes when you go, you can run on the sidewalk, or you can run on grass or sand. So try to avoid the hard surfaces. Putting the ice on your heel, like we mentioned, and then the over-the-counter anti-inflammatory you can use. You can use ibuprofen like Advil or Motrin. You can use naproxen like Aleve. You can use aspirin. Sometimes stretching your toes. So if you take your toes and you put your feet on the ground and try to lift your toes off the ground, that will stretch the tendon. Also stretching your calf muscle. And then with the tower, stretching your feet. Those exercises will help you to move the ligament and strengthen the ligament after you do the eyes.
So, Dr. Mencia, I think the people have to come to see you. If they're having that problem, don't suffer anymore. Go see Dr. Mencia. His number's 954-489-1345. Thank you so much, Dr. Mencia. It was really a wonderful, wonderful time to be together, and we've certainly learned a lot about plantar fasciitis. This was great. Okay, well, we'll see you next time, and have a great Saturday.
Thank you so much.
All right, bye. We'll be right back with Joe Karp. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
In times of joy, in moments of grief, broadcasters come through, even when all else fails. Today, with more ways than ever to experience the moments that transform our lives, Americans still choose broadcast radio and television more than all other media combined. We are the local broadcast.